Nurses, you want to change the patient to nurse ratio, then you need to get up. If nurses did every single thing by the book like they're supposed to, and they do not have the correct number of staff to cover the patients, then nurses should be going into overtime every single shift to stay over to finish that care. But what I see is all the nurses are rushing, giving bad care because they have to be out by, let's say, 7 p.m. So they rushed all their charting, they rush patient care, patients don't get baths, they don't get their call bells answered in a reasonable time, so patient scores are dropping. So hospitals say, well, we're not making money now, so let's make the nurses have more work. It's just a vicious cycle that's going around and around. To fix the problem, nurses, you are going to have to get up. When I say nurses is a common denominator right here, okay? You have nurses, you have your nurse assistants, register nurses, practical nurses, nurse anesthetist, nurse practitioner, but we all have that same common denominator, the word nurse. You look it up in the dictionary, a nurse takes care of people. So nurses' assistants get mad because the nurses come and get them, that they just came out of a room, this patient needs to be changed, and the nurse assistant gets mad because this nurse came out of that room to tell the nursing assistant to go into that room to clean the patient. Well, there's either two things going on. One, your nurse is lazy, or two, the nurse might have something else going on, such as a patient calling out in pain, which would be priority, or a doctor, she knows or he knows the doctor's going to come at a certain time and that he has to have, let's just say, urine output. He needs to have that documented. They know the doctor's coming, they got to get it documented, so they come to you and ask. Nurses are complaining about not having enough staff, yet they sit there on their phones playing games, on the phone with family members or friends. They're on the computers, on Amazon. There's videos in most hospitals so upper management can see what the nurses are doing. Let's say the nurse only has 3 patients with no CNA. That nurse is now going to have to do all that CNA work, which just because you call it CNA work does not mean it is not in your job description. Remember, we're all nurses. It is our job to make people feel better, to care for them. That means wiping their butt, changing their bed sheets, giving them a bath. It's not just the nurse assistant's job. It is all of our jobs for that patient to be comfortable and taken care of. So if we are short-staffed, that means the staff has to make the patient happy, make sure their care is sufficient, make sure they're getting better, and then they're going to have to just put that documentation to a side, write it down all day, just keep writing it down between rooms on pieces of paper, and at the end of your shift, then you're going to sit down and document. It has happened. I do it. It happens a lot. I will be there. I'm done at 7 p.m. I'm leaving at 9, 10 o'clock at night because I didn't have time to chart. So now they're paying me overtime because there wasn't enough staff so I can sit there and chart for 3 hours. Yet, I bet my patients' scores are higher for HCAHPS, whatever your state does for patient satisfaction scores, because my patients are taken care of, they're cleaned, they're bathed, they're not in pain, their rooms are clean. I do hourly rounding. I know it's a pain in the butt, but I do it because my patients usually don't have to call out for anything because I'm going to be there, or they know I'm going to be there. But the hospital is paying me overtime because I had to do all this myself because I did not have a CNA. So if all of nurses, CNAs, we all stick together and you actually do your job and get up and answer those call bells, answer those IV beeps, the bed alarms, you won't have time to actually sit and document So everyone's going to have overtime. So now your higher management is going to have to be like, oh, let's see, they're all getting overtime and staying late because they have not got their work done. So now we need to bring more staff in. So we're not paying all this extra money for low staffing numbers.